Healthcare clinic, we will see a huge prevalence of STDs, especially things like the bacteria chlamydia. Yes, we do will diagnose AIDS or HIV and gonorrhea. We offer testing to everybody, every client that comes in, pregnant or non-pregnant, and all ages. It doesn't matter what age.
Especially when it comes to HIV and AIDS, though, you're seeing a lot among minorities and women especially.
More so with minorities. African American and Hispanic patients will have a higher prevalence of HIV and other STDs.
What's happening out there?
The lack of knowledge, lack of education, lack of people desiring to be testing or just denying the fact that they should be tested. We will offer testing with every visit, whether they're coming in for a G1 problem or an annual pap smear. We offer that, but people are not really doing that as often as they should. It should be at least once a year.
So it's like getting a cholesterol test. They should get this every year.
They should. It should be a routine testing for anything they do. And everybody can do that. We can do that, of course, in any gynecologist's office. The health department is available every place in town for testing.
And I think that's what kind of maybe scares people. They feel like they need to go to a special place. But in a place like this where they get annual pap smear, they can get that kind of test.
Yes, they can. They don't have to have any symptoms or problems or even have that in their mind for the moment, but it's still a good idea to be tested because it takes months or years for that virus to show up as a positive. So really there should be, things could have been exposed to much earlier, do not know that. And so yes, I would highly recommend testing at least once a year for routine pap smears, along with the routine pap smears.
Because the new report is that more and more people are living with it, or with HIV, and they don't even know it because they don't get tested.
That's exactly right. And they're not going to be symptomatic right away. So yes, they do. And of course, the bad thing, it goes to the partner as well, then, without knowing that.
Yeah, and it's pretty scary out there.
It's very scary because one can die of HIV, or from AIDS. So a positive HIV is not the worst thing in the world because that can be treated and managed.
And I think that brings up another point, is that AIDS, HIV, is becoming more of a chronic now and not a fatal. So more people are living with this.
Yes, they are, and successfully and very well, good quality of life. So it really does pay to diagnose it early and get early treatment because one can live with that and do very well.
And what's the issue, though? I mean, as a doctor, as in this health field, there's kind of been a shortage of specialists out there to help with this kind of issue.
There is, I think, but our community lost a lot of OB/GYN providers, unfortunately. And so, but really everybody can do that. You have primary care people, family practice people, you have all your advanced nurse practitioners, your PAs, MDs.
So just to get to the prevention stage, we have enough people.
We have a lot of
and that's what's important.
But people need to ask sometimes. In other words, you go to your doctor for high blood pressure, let's say, they might not think about that, but they can test for that because it's a simple blood test.
Okay.
Very easy.
Great, Rita. But if we can get, hello, if we can get you kind of interacting with your staff and get some video of that.